Turning to today's update, I would like to review the weekend numbers and the outbreak at the Foothills Medical Centre, and then talk briefly about herd immunity. There are currently 63 people in hospital in Alberta, including 15 in intensive care. This number has risen somewhat in the last week, due in part to the outbreak at the Foothills Medical Centre. However, these numbers are still well within our health system's capacity. We continue to identify cases in all parts of the province. The total number of cases grew by 60 on Friday, while our lab conducted more than 16,000 tests. This lower number is the net difference between Thursday and Friday after adjusting for previously clinically reported cases. On Saturday, the lab again conducted over 16,000 tests and we identified 184 additional cases. Finally, 162 new cases were identified yesterday, while more than 18,500 tests were conducted. There are currently 1,549 active cases in the province, which is 52 more than on Friday. Turning to schools, as of today, AHS has confirmed that 20 schools that previously had alerts have had no transmission, and students and staff are all now back in class. There are active alerts or outbreaks in 113 schools, which is about 5% of the schools in the province. There are currently 210 active cases in total at all of these schools. This includes 47 schools which are on outbreaks, including 6 that are currently on the watch list. As always, I want to remind everyone that although 2 confirmed cases in a school may qualify as an outbreak, this does not mean that the school is unsafe. In fact, of all these alerts and outbreaks, there are only 9 schools where in-school transmission has likely contributed to 1 or more of these cases. However, we are being cautious and ensuring swift measures are taken even when only a couple of cases are identified. Sadly, I must report there have been 4 additional deaths from COVID since Friday. I know that people who have lost loved ones during this pandemic to COVID or to any other cause have had to grieve in different ways than we are used to. My thoughts are with everyone who is grieving the loss of a loved one now. One of the deaths reported over the weekend was a patient at the Foothills Medical Centre. This outbreak continues to be a significant concern, and a great deal of work is going into preventing any ongoing spread. 2 additional units are now under outbreak protocols. One is a transitional medical unit, where a case linked to an outbreak unit has now been identified. The other is a short stay unit, which is not linked to the other outbreaks, but has a single case whose source is unclear. Although the source of this single case could be community transmission, as a precaution, the unit has been put into outbreak protocols. This outbreak now has 53 cases in total on all units that are affected, including 26 patients. Sadly, 4 deaths have now occurred. AHS is working hard to support patients and staff, and I have been assured that outbreak protocols are in place on all affected units. While aggressive measures are being taken due to the long incubation period of this virus, it is likely that we will continue to identify additional cases in the days ahead. What is critical is to prevent any further onward spread or exposures, which is the focus of AHS's efforts. As an added safety measure, visitation to the entire site has been temporarily limited to end-of-life or pre-approved essential visitors only. AHS has also rescheduled 39 surgical procedures slated for today at the Foothills Medical Centre. All postponed surgeries are being rescheduled as quickly as possible, with many of them already rebooked within the next 7 days. There is also an outbreak at Millwood's Shepherd's Care Centre that is of concern. There are currently 19 cases linked to this outbreak. Sadly, 2 of the deaths over the weekend occurred in residents at this facility. AHS is working closely with the operator to support them and ensure that the proper outbreak protocols are being implemented. AHS staff are on site and meeting virtually to provide direction, consultation, and support. This includes a quality monitoring visit, which is standard practice for all sites on outbreak. Testing is being offered to all residents and staff, and I've been assured that all necessary steps are being taken to limit future spread. It's important to remember that COVID-19 is able to spread rapidly, and we are all interconnected. Adopting a herd immunity approach would have a serious and deadly impact on many people in the population. Even if we could put perfect protections in place for those who live in congregate settings like long-term care, while letting the virus spread freely elsewhere, we cannot simply dictate where and how the virus will spread. The more community transmission that we see, the greater the risk of it spreading to older and at-risk Albertans. In Alberta, about 30% of those over 80 who have been diagnosed with COVID-19 and who live in long-term care have died. For those over 80 living in the community, it is 18%, lower, but still very high. The lives of people with chronic conditions and our elders are very important. Adopting an approach focused on herd immunity would place many older Albertans or those with underlying medical conditions at risk and lead to many more deaths across our province. Our only protection from COVID-19 is each other, and we all share the responsibility of protecting our communities and our fellow Albertans. The second reason that this approach is not right for Alberta is that death from COVID-19 is not the only severe outcome. In Alberta, over the past 7 months, 1 in every 67 people between the ages of 20 and 39 diagnosed with COVID has needed hospital care. That rises to 1 in 18 for those aged 40 to 69, and 1 in 4 for those aged 70 and over. If we let the virus spread freely, our health system could be overloaded in caring for COVID patients, which would challenge our ability to provide all the other health services that we need. Babies are still being born, car crashes are still occurring, and our health system still must support Albertans in countless other ways. We have seen this overload happen in other countries. We do not want it to happen here. Finally, it's important to remember that we still don't know if being infected with COVID-19 actually confers any robust or long-lasting immunity. This means the costs of widespread transmission, the deaths and risks to so many Albertans' health, could be for nothing. We would put our elders and those with chronic conditions at risk, increase the burden on our acute care system, and still may not get the collective protection that this approach was designed to achieve.